Hi, I'm Arya Sharma, Professor of Medicine and Chair for Obesity Research at the University of Alberta. I'm also the Scientific Director of the Canadian Obesity Network. The Canadian Obesity Network was started with support from the National Centres of Excellence program and is the largest network of obesity researchers, obesity health professionals, and many other stakeholders with currently almost 3,000 members. One of the major functions of the Canadian Obesity Network is to really help network obesity researchers and other stakeholders together so that the information that is being generated within the many laboratories across Canada can be brought to the stakeholders and can inform policy and can really help both in preventing obesity but also in providing and developing better treatments for obesity. Obesity currently affects about 1/4 of the adult Canadian population. But we also have a crisis in terms of childhood obesity. I often say that obesity is a chronic disease because currently we really do not have a cure for obesity. This means that once you have put on the weight, although there are many ways that you can treat obesity, you have to continue those treatments for life. So for example, if you want to treat your obesity by going on a diet and you lose the weight, you essentially have to stay on that diet forever, because when you go off the diet, you're very likely to regain the weight. Similarly, if you want to lose weight by running 5 kilometers every day, well, once you've lost the weight, you actually have to continue that level of exercise to keep the weight off. If you decide to cut back, the weight comes back. Similarly, when we talk about pharmacological treatment of obesity and you decide to take a drug to treat your obesity, you essentially have to continue taking that drug, because if you stop taking it, again, the weight comes back. Interestingly, the same is also true for bariatric surgery. If you decide to treat your obesity with surgery and you have your stomach stapled, once you've lost the weight, you cannot just go in and take out the staples, because the weight would essentially come back right away, which means that even obesity surgery is a long-term form of treatment. So because obesity is a chronic disease and because it is so difficult to treat obesity, we really have to unite our efforts in terms of preventing obesity. And this is where the Canadian Obesity Network can help coordinate some of those efforts by bringing the best practices and by bringing the latest research from Canadian universities out to the community, and to help inform policymakers about the policies that they should make based on hard evidence that comes out of these many studies. One of the big problems that we have is that we do not have enough health professionals and researchers who are trained specifically for researching obesity or for helping patients with excess weight. This means that we need to now rapidly train a whole next generation of researchers and health practitioners to really work in this field and to help develop the new knowledge that we are going to need both to prevent and to offer better treatments for obesity. The Canadian Obesity Network therefore has placed a large emphasis on supporting capacity building initiatives. For example, the Canadian Obesity Network has partnered with the CIHR Mark Frost Chair in Obesity at Laval University to provide a 10-day boot camp, which is a camp that brings in the best students from across Canada, students working in very diverse areas all the way from cell biology to city building, to train them and to give them exposure to some of the best experts in the country in order to get them to get to know each other and understand the dimensions that others are working on, which will ultimately help them not just to establish personal networks, but also to get a much broader view of some of the issues that are so important and so difficult to tackle.